Welcome. Today we'll learn about a medicine called Rovista. Rovista, it is used to lower cholesterol and fats in the blood. Therapeutic indications, uses, Rovista, Rosuvastatin, is indicated for the treatment of hyperlipidemia and mixed dyslipidemia, as adjunctive therapy to diet to reduce elevated total C, LDL-C, ApoB, non-HDL-C, and triglycerides and to increase HDL-C in adult patients with primary hyperlipidemia or mixed dyslipidemia. Lipid-altering agents should be used in addition to a diet restricted in saturated fat and cholesterol when the response to diet and non-pharmacological interventions alone has been inadequate. Pediatric patients with familial hypercholesterolemia, as an adjunct to diet to reduce total C, LDL-C and ApoB levels in children and adolescents 8 to 17 years of age with heterozygous familial hypercholesterolemia if after an adequate trial of diet therapy the following findings are present: LDL-C and GT 190 mg per deciliter or in GT 160 mg per deciliter along with a positive family history of premature cardiovascular disease (CVD) or 2 or more other CVD risk factors. As an adjunct to diet to reduce LDL-C, total C, non-HDL-C and ApoB in children and adolescents 7 to 17 years of age with homozygous familial hypercholesterolemia, either alone or with other lipid-lowering treatments, e.g. LDL apheresis. Hypertriglyceridemia, as adjunctive therapy to diet for the treatment of adult patients with hypertriglyceridemia. Primary dysbeta-lipoproteinemia, type 3 hyperlipoproteinemia, as an adjunct to diet for the treatment of adult patients with primary dysbeta-lipoproteinemia, type 3 hyperlipoproteinemia. Homozygous familial hypercholesterolemia, as adjunctive therapy to other lipid-lowering treatments, e.g. LDL apheresis, or alone if such treatments are unavailable to reduce LDL-C, total G, and ApoB in adult patients with homozygous familial hypercholesterolemia. Slowing of the progression of atherosclerosis, as adjunctive therapy to diet to slow the progression of atherosclerosis in adult patients as part of a treatment strategy to lower total C and LDL-C to target levels. Primary prevention of cardiovascular disease in individuals without clinically evident coronary heart disease but with an increased risk of cardiovascular disease based on age 50 years old in men and 60 years old in women, HSCRP 2 mg per liter, and the presence of at least one additional cardiovascular disease risk factor such as hypertension, low HDL-C, smoking, or a family history of premature coronary heart disease. Rovista, Rosuvastatin, is indicated to reduce the risk of stroke, reduce the risk of myocardial infarction, reduce the risk of arterial revascularization procedures. Adverse reactions, side effects. Rosuvastatin is generally well tolerated. Adverse reactions have usually been mild and transient. Common headache, dizziness, constipation, nausea, abdominal pain, myalgia, asthenia, and diabetic mellitus. Uncommon pruritus, rash and urticaria. Rare hypersensitivity reactions, including angioedema, myopathy, rhabdomyolysis, thrombocytopenia, increased hepatic transaminases, lupus-like syndrome, muscle rupture and pancreatitis. Thanks for watching and supporting. Take your medicines as your doctor or pharmacist prescribes them. You can check its article at MedsArchive.com. Have you ever used this medication? Please share your experience in the comments. Which medicine should we cover next? Your suggestion could be our next video. MedsArchive 1.